Tell us about this study. What more do we know?
Yeah, it's quite an interesting study. I mean, we've known for a while that there's a link between eating too much meat and having bowel cancer, colorectal cancer. But as you just said there, Kamali, this study from Oxford University has gone an awful lot further. So they questioned nearly 500,000 middle-aged adults in the UK, 475,000, back in 2006 to 2010. And these were people who were going to hospital for 25 different reasons, not to do with cancer. And whilst they went into hospital, they were asked to fill in a questionnaire that included what's their dietary habits. Then they were followed up for an average of about 8 years. And that's when these results have now been collated and brought together. And it's shown that basically, if you're eating red meat and processed meat products more than 3 times a week, you really are increasing the risk of heart disease, cancer, pneumonia, diabetes, a whole range of diverticulitis, digestive diseases, ones that you might not necessarily have thought of were linked with red meat. And it's quite surprising because also poultry was included in this. If you ate poultry very, very regularly, that increased your risk of diabetes and of acid reflux. Now, as you said there, what it didn't do was increase the risk of anemia. In fact, it was the opposite way round. So the lead authors of this study, Dr. Karen Papier, has said that it's shown that people who don't eat meat should take iron tablets or ensure that they are getting their iron from other sources instead. So, how much meat do people generally eat? So the advice is quite interesting because the World Cancer Fund actually says that you should only have red meat 3 times a week and you should never eat processed meat products. And these are bacon, sausages, but also patés and salamis, some of the Mediterranean foodstuffs that we eat. So the advice, say, for example, from the Department of Health here in the UK, is that you should, if you have 90 grams of meat per serving, so what is 90 grams? That's like 3 thin slices of meat, the equivalent of about 1.5 slices of bread, so a very small amount. So the Department of Health in the UK and in many other countries says that's too much. You should cut it down and only have 70 grams of meat 3 times a week, and that's the most you should have.
Interesting, and this is kind of on the healthy eating topic we were talking about yesterday with the obesity, I guess, and the coronavirus. And I'm wondering, Nicola, if this is going to give extra succor to those who are trying to make people go more vegetarian or even vegan.
Yeah, that's really interesting, isn't it? Because, of course, as you said yesterday, we talked about obesity, and that makes it affects your immune system. I was asking a nutritional therapist this morning, Veronica Gibson, why this would be the case, because actually the study itself says there's a whole different variety of reasons why they think eating too much meat does have an impact on the body. For example, we know that red meat's high in saturated fat, and that can affect heart disease. We know that processed meat that's either smoked or salted is bad for us. They don't know whether there's a causal link, but one of the things they did realise was BMI, whether you were overweight or obese, definitely had an impact on this. When I spoke to Mrs. Gibson, she was saying that one of the issues is that people, when they're eating meat, they eat too much protein, and apparently to digest protein we create a lot of acid. If you're not eating enough fruit and vegetables, you're not having enough alkaline, so that's affecting the acid-alkaline balance that we have in our body. And also, if you are eating too much weight, and you are overweight, you've got this constant low levels of inflammation that we discussed yesterday, so that's impacting on your immune system. So yes, I mean, veganism is incredibly popular today. A lot of people will say, well, look, we shouldn't be eating meatstuffs at all, and that will be better for us. So, whether that's going to make it more popular or not, I don't know.
Well, we'll see about that, but I do still enjoy a good steak. For now, thank you very much.